I'm going to be honest. Before having children, I don't think I knew anything about my pelvic floor. And despite having bladder leakage issues, I didn't truly learn much about the pelvic floor until several years after I had my girls. Whether you know nothing about the pelvic floor or you do know some things about it, but you're curious to learn more, today's episode is for you. My guest is Dr. Danielle Bailey. Dr. Bailey is a pelvic floor physical therapist in the Dallas Fort Worth area. Her practice is 360 Health and Wellness. She is also a mom of 3 young children. I invited her on the podcast after hearing her interviewed on another podcast, and I can't wait for you all to meet her and for all of us to learn a little more about our pelvic floors. Before we dive in, I just want to note that everything that Dr. Bailey shares today is intended to be educational and should not be considered medical advice. Hi, I'm Allison Edgety, a pediatric sleep and wellness coach and a mom of 2. I love to help parents find solutions. This is How Long Till Bedtime. Well, hi, Dr. Bailey. Thank you so much for joining me today. I think it's fair to say that I am very passionate about children's sleep, but right up there with my love for sleep is my passion for maternal health. And we've talked a lot about maternal health on this podcast, but another area that I think we haven't touched on as much as things like mental health is a mom's recovery from pregnancy and delivery. So I'm excited for us to have this conversation today. But before we dive into all things pelvic floor, I would love to learn a little bit more about you. I'm always interested in learning what inspired people to choose their career and specifically their niche. So I would love to start there. What inspired you to become a physical therapist? And then what really pushed you to focus specifically on pelvic floor health?
Yeah, well, I'm glad to be here. Thank you so much for having me. I was first inspired to become a physical therapist back when I was, I think, 17 years old. My now late grandmother, she had a stroke, and she's this very independent woman. She would cook for the whole neighborhood. Was always doing things for everyone else. And when we got the call that she had a stroke, it really changed her life completely. So she became paralyzed on one side of her body, and it was very debilitating for her. And I was able to witness the journey of what physical therapy and rehab was able to do for her. And so I saw this process over the course of 3 to 4 months where one side of her body was immobile to be able to then again regain that strength and resume all those types of activities that she really enjoyed. And so when I saw that, I was like, wow, this is pretty cool. I want to be a physical therapist so I can help people in her situation. And little did I know about the all the areas of physical therapy, but I knew that I had a passion for really just helping people transform their lives. And so, in high school, my senior year of high school, I knew that's what I wanted to pursue, and I went for it. And this is 13 years later of being a physical therapist. And it wasn't until I was pregnant with my first child that I began to really develop an interest for pelvic floor physical therapy. I was working at a hospital here in the Dallas Fort Worth area, and a coworker and friend, she said, "Hey, you should really consider pelvic floor physical therapy." And I was like, "Huh." And I had a little interest in PT school, but I didn't really know that's what I wanted to do. And I had some aches and pains with my first child, and she's like, "Hey, let me help you." So she was able to help me with my hip and back pain and give me some strategies that were very helpful for me. And it was from that moment I was like, you know what? I think this is what I really want to do. So I was able to cover for another coworker who went on maternity leave for pelvic floor. And since then, I never turned back. So that's what got me into pelvic floor physical therapy after graduating from physical therapy school.
I love that.
Yeah.
So let's start with the basics. Can you please start by explaining the pelvic floor? So let's talk about the function of the pelvic floor and what it actually is.
Yeah. So I like to start off by talking about the pelvis and just to kind of explain where it is anatomically. So it sits right in between our upper portion of the body and our lower portion of the body. So our trunk and our legs essentially connect into the pelvis. And so in the pelvis, we have something called the pelvic cavity, which a cavity is like a space or an area, and in the pelvic cavity, it houses different organs, muscles, you got ligaments, different types of vasculature, and that's the pelvic cavity. Inside the pelvic cavity, on the bottom is considered our pelvic floor. It's like a little hammock, and it helps to support those internal structures. And so when we talk about pelvic floor, we're specifically talking about that bottom layer of the pelvis that supports everything, but when treating someone with pelvic floor issues, we of course we don't ignore the other components of the pelvic cavity. And so the pelvic floor essentially has three main functions. One is to support those internal structures. The second thing is to help prevent someone from leaking on yourself. So it helps to avoid the peeing and pooping on yourself. And then the third main function is to aid in sexual pleasure. So those are the three main functions of the pelvic floor.
Awesome. And what effect does pregnancy or giving birth actually have on the pelvic floor?
Yeah, such a great question. I see a lot of pregnant women, and especially if you're a first-time mom, it's kind of shocking to you of all the changes that can happen in your body from being pregnant. But there's a lot of hormonal changes that happen when you do become pregnant. There's a lot of ligamentous laxity, meaning things are more loose. There's not as much stability, and so oftentimes people will complain of pain in like their pubic bone and their back or their hips. They can't walk as well because of the changes in these structures due to the hormonal shifts that happen. So one, it can cause some issues with your, musculoskeletal function, meaning your joints are not as supportive. The other thing for some people is that they may have pain with intercourse. In pregnancy, it can be very uncomfortable for intercourse, but sometimes a lot of women can experience just pain in general with intercourse. Also, because of the growing baby in the uterus, it also causes some stress and strain to the pelvic floor muscles. And so a lot of times women become have more weakness in the pelvic floor. And so we might notice issues like incontinence, which is the inability to hold in urine. For some women, it's, I can't, hold in stool as well as I can. And so it causes a host of different issues, not only with the structures of your body, but also the ability to maintain yourself, keep yourself dry from urine and stool.
So when you say incontinence, just so we're breaking it down here,
Yeah.
you're talking about urine, being able to hold in your urine the way you typically would, and stool.
Correct. Yes. It's incontinence is the inability to hold urine in, the flow of urine from the bladder or stool from the rectum. So when that happens, we have issues and we need pelvic floor PT.
Definitely. And so you've mentioned kind of some of the symptoms that we might experience during pregnancy or post pregnancy. And I'm curious about less common symptoms. So I think if people are familiar with the pelvic floor, kind of feeling discomfort in that area, or even I think the leakage, people are starting to get more educated on that. But you've also touched on things like hip discomfort, like joint discomfort. And could you elaborate a little bit on less common symptoms that people might be having that they're not logically connecting to as a pelvic floor issue?
Absolutely. So yes, definitely the hip back pain, very common. Some, or I should say, less common that people think they can come to a pelvic floor PT for. Some issues include like tailbone pain. Maybe you're sitting down for a long period of time and you're noticing your tailbone hurts. A pelvic floor therapist can actually help to support that. Maybe you have constipation and you only think to go to a GI doctor, which GI doctors are very important, and I'm not ignoring that fact. But a pelvic floor therapist can also help with supporting that, teaching you different strategies and ways to help with the constipation and things to look at your diet and see what you're eating throughout the day, as that may affect your constipation, and then strategies that you may or may not be using effectively when you're sitting on the toilet. And so, those are types of things that are less common that people may think about. Some people may not even be aware that things like the abdominal separation or the diastasis recti, that a lot of people experience as well with pregnancy and even without pregnancy. I have seen clients that have those types of issues that never knew. Oh, I didn't know I can go to a pelvic floor therapist for that. And that's where those abdominal muscles separate, and a pelvic floor therapist can help to support that as well. And I'll even say diarrhea is another common issue that, or I should say, uncommon issue that people think they may not be able to see a pelvic floor physical therapist for, but can find a lot of support from a pelvic floor therapist if they have issues like diarrhea. So, teaching you how to form the stool and looking at other factors, lifestyle factors that affect those types of issues.
And are you unique in the fact that you take a more holistic approach? Because I have read about some of your work, and I know you're more you're interested in the functional whole picture, which is totally my jam.
Yeah.
Are you unique in that, or does the average pelvic floor therapist understand, what we're eating and how that can play a role in all of this?
I would say not all pelvic floor physical therapists do that. In most training of pelvic floor physical therapy, we do touch on diet, like making sure you're hydrated, making sure you have enough fiber. And so, in that regard, most pelvic floor therapists would incorporate that in their practice. For me, I look a little deeper and say, okay, what food sensitivities do you have? Is there any dysbiosis going on in your gut that's contributing to some of these issues you're having with like constipation or diarrhea? What's your lifestyle like? How is your stress affecting your pelvic floor and your body as a whole? So I do dig a little deeper because of the functional medicine background. And I will say not all physical therapists do that. Some just say, hey, do Kegels all day, which I know we'll touch on in a little bit. But it's not all about that. There's a whole, gamut of things that need to be incorporated when treating a patient, because there's several different factors that can affect your pelvic floor function.
Absolutely. I think it's just worth pointing that out, that they're not gonna find every, pelvic floor therapist has this knowledge around the more functional aspect, and it's interesting you bring that up because I was very naive. There's so many things I was naive about before having my kids, and I didn't know about pelvic floor physical therapy, and so I kinda went on my own healing journey, but a huge thing that happened, I guess, at this point when my daughter was almost 7 and I found out I had a gluten intolerance, was my ongoing chronic hip pain that I had had since I was pregnant with her, so I kinda dealt with it for about 7 years,
Wow.
went away when I dropped gluten, and I got back to running. I had other old injuries like my knee, and during my pregnancy, my left shoulder had started to hurt. It was very random, and, but reducing that inflammation
Yes.
kind of allowed my whole journey to take off, and I was able to get back to running without the hip pain, without the knee pain, and I was able to strengthen my core to stop the leakage when I ran.
Yeah.
So,
Yeah.
that big change of dropping gluten for me really opened the door for me able to even do the training I needed to strengthen my core and my pelvic floor and get everything back in shape. So I do think if people are struggling in almost any area, I think we can agree on that.
Yeah.
Taking a more comprehensive look at things can help.
Absolutely. Because, some patients, they'll come in with pelvic pain and they'll say they've done all these, procedures and nothing's really helping. And I'm so glad you brought that up because, if you have this chronic inflammation buildup in your body, it's going to create havoc to your system. And so being able to just step back and say, okay, what am I sensitive to food wise? Gluten being a very common thing that many of us are sensitive to, for some people is life changing when they really eliminate that from the diet. So, yeah,
Absolutely. Well, you mentioned Kegels,
yeah,
and I'd love to dive into that a little bit because I think most moms at some point have been told it's really important to do your Kegels after giving birth. And maybe since I was last recovering from a birth 8 years ago, we have started to shift away from that a little bit, but I do think some of our, old school doctors are still recommending this, and I'm curious, what are your thoughts on Kegels?
yeah. So, Kegels is, a type of exercise that was created by a gynecologist. I think his name is Arnold Kegel. And he wanted to find a non invasive way to help women that were experiencing urinary leakage. So, whenever I talk about Kegels to my patients, I really try to interchange it with the word pelvic floor muscle contraction as best as I can. Because oftentimes, when people think about a Kegel, they, recruit every single muscle fiber in their body to try to recruit their pelvic floor. And so being able to teach patients, one, how to effectively do a Kegel, and then two, also explaining, is this really necessary for you specifically? Because I'll have clients that come in that say, I've been doing Kegels, for the last 3 months and nothing's getting better. And so when I evaluate the patient, I'll determine that Kegels are actually making your problem worse because you can overactivate your pelvic floor. And if you overactivate your pelvic floor, that can create tension in the pelvic floor. And you can have all this built up tension for, around your bladder, for example, and that can cause you to have this, urgency to urinate all the time. Or it may create this tension around the bladder where you are having some urinary leakage. And so the goal is to be able to teach patients, one, how to effectively do one if we need to do one. And if we don't need to do them, untrain them and say, you know what, we need to downtrain the body a little bit because it's actually creating a bigger problem. So I do not believe that Kegels are the solution for every single type of pelvic floor dysfunction. And I think that's the misconception that, oh, you have leakage or you have pain. Do your Kegels, that'll fix it. And that's actually wrong. And so it's important to get adequately assessed to see if that's even something you need to do. And then I'll also mention too that even if it is something that may be beneficial for a patient to engage the pelvic floor, there's so many other activities and exercises that actually naturally engage the pelvic floor. So I don't just prescribe Kegels to all my patients. We'll do a lot of core stuff and we'll do things dynamically where we're focusing on running and squatting and lunging and doing all these types of other things that will help to engage the pelvic floor in such a way that is functional for the patient so that when they are in the gym, they're not leaking, but they're effectively using their core and they're not over recruiting their pelvic floor. So it's supposed to be a nice dynamic and balance of all these different muscle groups versus just, squeezing the pelvic floor all day.
Right. Yeah, it's interesting because before I met someone in this area and really understood what was being offered, I had started working through Peloton on just their app. And one thing that I liked about their app was they talked a lot about your form. And as I adjusted my running form and did some different things, I was like, "Oh my gosh, I just did a whole run without leaking," or I did this whole lower body workout and I didn't have leakage. And when I talked to a pelvic floor physical therapist about it, she said, Well, A, you probably have good body control, which I do because I rode horses, and so I can kind of have someone tell me something and adjust pretty well, which I recognize is not a strength for everyone. But she said it absolutely makes sense. If you tweaked your form and you didn't realize you were out of form, it gave you the ability to engage what you needed to engage.
Yeah.
And it was a complete game changer. And so I've told many moms when they complain to me, I will say, see a pelvic floor physical therapist because they could make some very small tweaks to the workouts you may already be doing or help
Mhm.
you with certain strength training exercises. And so I love that you're kind of incorporating it into maybe how people are doing their workouts anyway.
Yeah, absolutely. Absolutely. I had a runner just a couple weeks ago come in and she was leaking while she was running. She has 4 children and she's like, I want to run without leaking. So she came into the clinic and I do use something called biofeedback, which is a little device that um, gives you feedback on, are you relaxing your pelvic floor? Are you engaging your pelvic floor? It really helps the patient to build more awareness. And so we did it, and as we were looking at her form while she was kind of in her stance for running, we noticed that we needed to change the way her hips were postured and her feet were postured. And that made such a difference for her. And so it's so important that when seeing a pelvic floor therapist, they do look at the whole picture and the whole body versus, is that small area, is just the pelvic floor weak or strong? And being able to look at everything else as a whole to make the proper adjustments for the patient.
Yeah,
Yeah.
awesome. Yeah, I kind of fell out of my strength training, and I'm curious your thoughts on this, but I started after going well over a year without leakage issues, then I kind of fell out of strength training and my leakage issues returned. Is
Mhm.
that common?
It is common, if because there are muscles that get weak, just like our glutes can get weak, our core can get weak. I like to encourage patients that even if you're not working out, 5 days a week, at least you're doing 2 or 3 days a week, even if it's for 15 minutes, just to maintain where you're at. It's kind of like the medication you don't want to take anymore. You may be on this medication for a while for whatever reason, but the goal is to be able to change lifestyle so that you can wean off from it. And so with pelvic floor dysfunction, I always encourage, even if you've reached your goal of not, leaking when you're running or having this urgency, at least doing something, even if it's a small amount. I even say 5 minutes a day if that's all you got. But just a few times a week to maintain what you've worked on can help prevent you from having a little bit of a relapse.
Right. And it cleared up much faster. So as soon as it started, I kind of registered this makes total sense. I've stopped doing my strength training. And it only took a few weeks of,
Yeah.
like you said, my goal is 3 times a week. It only took a few weeks of getting back to 3 times a week. And I got on the treadmill and ran and I thought, okay, I'm good. I'm back to steady state.
Yes.
Nothing's leaking out.
Exactly.
Well,
Yes.
all of these, the kind of basic knowledge is super helpful. I'd love to know when you think someone should see a pelvic floor physical therapist. So more specifically, at what point should someone stop assuming that this will get better with time? You've actually touched on potentially while being pregnant. I guess I'd love to know what are the kind of triggers or things that we should look for where we might think, I bet a pelvic floor physical therapist would have some insight on this.
Yeah. I would say on at the onset of any type of symptom you may experience, which can include I'm noticing myself go to the bathroom a lot more. I'm having pelvic pain. Um, I'm having pain with sex. It's really uncomfortable. When I sit down for more than 10 minutes, my tailbone hurts. And I think at that point, when you experience the onset of those symptoms, seeing a physical therapist sooner than later is going to be better for you in the long run, because it's important to be proactive versus reactive. I'm always about being proactive. And if you can kind of get a handle on it in the beginning, it just makes the outcome much better. So, yes, pregnancy is definitely one area, one say season of your life, that you should definitely see a pelvic floor therapist. But for the non-pregnant woman, even if you haven't had children, if you're noticing these types of issues, go to a pelvic floor physical therapist right away. And I'll even say this too. I've had people that come in that have never had children, have never been pregnant, and they just want to get assessed. I think it's worth doing it. Just go and get assessed. You may only need a session. You may be fine, but it's just important to know where you're at, to see if there are areas for improvement or things that you can tweak a little bit. I've had clients come in that only need a couple sessions, just a couple of strategies, and they're good to go. So it's worth it just to be more proactive than reactive. But definitely, if you're experiencing any of those types of symptoms, to go right away, because it will get worse over time if you don't address it. It's not just going to get better.
Absolutely. And this is probably varies practice to practice, but would you typically need a referral to see a pelvic floor physical therapist, or can you typically call one and set up that intro appointment?
Yeah. So in the state of Texas, where I live, which we have more of the strict rules compared to other states, just in the last few years, a patient can come directly to a pelvic floor physical therapist without a referral. We just have 10 days. 10 business days to send over what we call our plan of care. So after I see the patient, I write up the report, I send it over to the doctor within the 10 days, and the doctor signs it, and that serves as the referral. Some states there's completely direct access, so it varies from state to state, where you can just go to a PT. It doesn't require you to have a signature from a physician after a certain amount of time. But in Texas, what's nice now is that you can come directly to me or to a physical therapist, but we do have to have some communication with a doctor or nurse practitioner or midwife, um, as long as you're going to continue, care on with the physical therapist.
That's helpful. And you've mentioned leakage, which I want to talk about a little bit more. But one thing you've mentioned that I have not thought about as much or connected to pelvic floor is needing to urinate more often. So that could be connected to your pelvic floor as well.
Absolutely. So some people have this urgency or frequency to use the bathroom. Maybe, they're like, every time I go out to the mall or to a restaurant, I got to find that bathroom right away, because if I don't, I feel like I'm going to pee on myself. And it's a very common problem and debilitating issue for many people, because you want to feel like you can go out and have a great social life without worrying about, oh, am I going to actually leak while I'm out? And so some of the things that pelvic floor therapy therapists can do is work on a bladder training schedule, where, and this is what I do with many of my clients that come in with this issue. One, for one, it can be weakness to the pelvic floor, but two, it's a habitual thing that we need to retrain our brain to be able to hold urine for a longer period of time. So I typically tell clients, when you're using the bathroom, I want you to try this at home. I want you to count to about 10 seconds, 7 to 10 seconds. So one 1,000, two 1,000, three 1,000, all the way till you get to 7 to 10 seconds. And while you're urinating, if you get to 7 to 10, that means that was a pretty good void. If you're going less than that, then that actually means your body can actually be trained to hold in the urine for a longer period of time. And so, what happens if you're going more often than you should? You're weakening the pelvic floor. You're telling your body, oh, I can't really hold it. And so, you have this frequency and urgency to go to the bathroom more than you really need to. So, very common issue that people come in for. But it's very surprising to many patients when we get them on this training schedule and this bladder diary, where they can log when they actually go to the bathroom, how long are you peeing for. They're very surprised at how often they're going and how little they're voiding when they're actually using the restroom. So it's very fascinating to see how we can retrain our brain.
Yeah, so interesting. So, on the topic of leakage, I mentioned I'd had leakage for years before I knew better and that could be fixed without surgery. Uh, If someone has had leakage for years and hasn't done anything about it, is there a point where it's too late to fix it? Or generally, do you feel like in the average case, there are things that can be done?
I always feel like there are things that can be done. It's never too late. You know, you may not get to 100%. Maybe you're wearing a thick pad, all day and you're having leakage, 6 times a day. Maybe we can get it down to 2 where you're wearing a liner. That's a big progress for many people. And I say that because that's just reality. I see a variety of clients. Some people we can eradicate the whole issue. And some people, because it's been so chronic, we may not be able to get to 100%. But if we can get down to, 80% progress, they're very happy and content with that. So it's never too late. I've seen 95-year-olds that come into the clinic that think it's too late, and they even tell me, I don't think you can really help me. I'm an old woman, and I don't think there's anything you can do. My mom told me that she had this issue, when she was, after she had children or during this stage in her life, and I think it's just going to be the same for me. And so after a couple months of working together, they were like they come and to the realization that, wow, I didn't realize you could really help me, but I really see a difference in my life now where I'm not, peeing on myself all the time and wearing these depends, and they're very grateful. So I say that to say there's always room for progress. There's always things we can work on, and it's never too late regardless of how old you are or how young you are.
I think that's important to point out because it's not just a pregnancy, recent postpartum area. It could be, like you said, all the way to 95 that
Yeah.
people may have pelvic floor weakness that could be addressed.
Yes, absolutely. Yeah.
Love it. Well, at one point, I had told my OBGYN about an area where I had discomfort and I felt like there was scar tissue that had built up. And actually, he evaluated. He said, "Oh, it's where you tore during delivery. You had scar tissue built up." And I said, "Okay, well, is there anything I can do about it?" And he said, "Oh, yeah, yeah, yeah. You should see a physical therapist." And he kind of wrote down someone's name and he did not elaborate at all. This was my first exposure to the concept of pelvic floor physical therapy. I was totally baffled. He just brushed it off. He gave me this piece of paper because I have been to a lot of physical therapy. I've broken my neck, I blew out a knee. And so that's how I think about physical therapy. And so I walked out of there thinking, what in the world would that appointment look like when I have this internal pain? And I'm a fairly modest person in that regard. So I was thinking, no, no, no way. So I didn't technically know it was a pelvic floor physical therapist. I never went to see this person, but I would love for us, if there are other people like me who are clueless, could you explain what would an initial visit look like if someone were to come to your office for pelvic floor evaluation, or for what I'm talking about where you kind of have some discomfort where there's probably some scar tissue from your delivery? What would that visit look like?
Yeah. So the initial visit is a very, for me, for what I do in my practice, a very extensive session where we talk a lot about your history, your symptoms, what's going on. Maybe if you have had a birth recently, what your birth experience was like. Was it traumatic for you? How much did your baby weigh? How long did you push for? All those types of things are discussed. We talk about your diet and just lifestyle things that affect your symptoms. And then after the time that we speak about your history, I do a postural assessment where I look at your posture, looking at your back, your hips, seeing if there's any asymmetry there because we want to help to support that as best as possible. And then I'd say even before we get to the next portion of the exam, I do explain to the patients, hey, this is what we're going to do today. After I do your postural assessment, I'm going to do an internal assessment. And I preface it with this, it's not going to be as invasive like a pelvic exam or pap smear from your doctor. I'm just going to use a glove with a little bit of lubricant gel, and I'll insert my finger into the vagina and test the muscles of your pelvic floor. And then I always say, at any point, if you feel very uncomfortable, it's too painful, let me know. We'll stop. I never force it for any client if they're having a lot of symptoms or if they just don't feel comfortable, because it's also important as a pelvic floor physical therapist to be sensitive to people's traumatic experiences in the past, where some of them just may not want that, and that's okay. We can work around that. But the majority of the time, with patients' consent that say, yes, you can do an internal exam, we do that exam to test the muscles of your pelvic floor, see how you contract, how you engage. Are there any areas of tension? So, for example, in your case that you mentioned, if you have some scar tissue, we can feel for that scar tissue. And if it's painful, well, we do some soft tissue work over that area to help break up that scar tissue. So it can feel uncomfortable, but over time, it does get better. And there's different tools and devices that I recommend to patients sometimes that they can, implement at home to help with that. But that internal exam is very important and helpful for the therapist just to feel what's going on with those muscles and see what ways that we can help support if there's any areas of tension or scar tissue there. And then after the internal exam, based on what I assess, I will prescribe some exercises to start with for home, just as a baseline of, hey, this is where we're at. And I want you to start with these exercises, and then we're going to progress from there. So that's typically how the initial appointment goes. My appointments are about an hour to an hour and a half. That way, it's very thorough, and patients' questions can be answered, and they feel like they're getting the support that they need.
I think that's helpful. I think that's something that at least the doctor I saw, maybe if he had spent a little more time saying, "Hey, maybe you don't know this, but there are people who specialize in this area. This is what they do. It's not the guy who rehabbed your knee. It's not gonna be the person who's helping you figure out this internal scar tissue area." And I assume people who are in this area are probably very much like you in the fact that they are very sensitive to people's, personal comfort around these evaluations. So I
Yeah,
think that's really helpful.
absolutely.
If someone is listening and they're thinking, "Oh, I'm one of these people. I should see a pelvic floor physical therapist," but they start to look into it and they realize there isn't one in their area. Can they get help online, or are there exercise that you recommend everyone could benefit from? I know you've touched on, Kegels is not the answer for everyone. Is there one exercise that you think, I have not met someone who could not benefit from this exercise, or do you have online resources that you suggest people start with?
So I'm a little cautious with that just because I don't know how everyone presents. Do they carry their tension in their pelvic floor, or maybe do they carry a lot of tension in their core muscles? How do they breathe? What's their breathing pattern like? Because that's a very important component for pelvic floor. If I were to give any exercise, I would say some good diaphragmatic breathing, because that naturally will help move the pelvic floor up and down without you having to consciously engage the pelvic floor. So I don't feel that, aside from diaphragmatic breathing, because you can never go wrong with that, that there's really other exercises that I'll say, oh, everyone can do this, because it does. It is very customizable, and it is not cookie cutter, because what one person may come in for leakage is due to a weakness issue. Another person may come in because it's a tension issue. And so it's really important to get assessed. And there are therapists. I do help support people online via telehealth, where we can assess certain things via camera, where I can definitely make recommendations there. But to, like, Google, what should I do if I have leakage, I think is a little dangerous, because I've had clients come in that say, I've tubed everything and I've Googled and I'm not getting better. And then after a visit, they notice a significant difference just because they're getting adequately assessed on where they're at. So I think that if anything, let's say if you can't find someone in your area, there are therapists that do telehealth, like myself, that can help support you. And then the other thing, too, a nice resource for patients that may not find one on Google. I mean, some patients find me on Google, but there's a website called apta.org where you can type in your zip code and you can uh, type in pelvic floor physical therapist and they can spit out one in your area. Another good website, and it's a directory, is called Pelvic Guru. Pelvic and then GURU. I think it's .com. You can do the same thing, type in your zip and find a physical therapist in your area. So,
Oh, that's great.
yeah,
Perfect. Well, we'll link to that in the show notes so people have links to those. I think that's helpful. Even where to start to find one
yeah.
is helpful. So I have a few other random questions that I wanted to ask about. I've recently heard a few people online talking about the squatty potty. Are you familiar with the squatty potty? And can you fill us in on the squatty potty?
Yes, I love the squatty potty. The squatty potty is basically a type of stool that sits around the toilet, and you place your feet on the squatty potty, and it really helps to minimize straining, especially with bowel movements. So back in the day, when people used to have a bowel movement, they would have to go out to the outhouse, and they would squat on the floor or squat close to the ground, and that's how they would have a bowel movement. And it eliminated straining of the pelvic floor muscles. And it also helped with people that may have had constipation. So the squatty potty, what's really nice about it is it mimics that same type of position. And so for patients that do struggle with constipation, or maybe they just don't really know how to relax when they're having a bowel movement, the squatty potty can help to facilitate that. So it's a wonderful tool that I recommend everyone get if you don't have one. Another little trick is if you have toddlers and they have a little step stool in the bathroom, you can use that as well. It works as effectively as a squatty potty. So, very helpful to use, especially if you're struggling with constipation um, and just can't, get the stool out.
Now, it's making me think about our young kids and constipation. Is it something that could help kids? Because their legs are just downright dangling from the big
Hmm.
toilet. So, could it help young children, whether it's the squatty potty or figuring out some other way to help them get a better angle?
Absolutely. Absolutely. I have my kids use it all the time. We have the step stool and just slide it over and just put your feet on it. And they're able to have a comfortable movement without the strain. So for kiddos that do struggle with constipation, it's very helpful for them because you're right, their feet are dangling because they're small people and they need that support. So absolutely, it can be helpful for them.
Yeah, interesting. And, we talked a little bit about that urgency and that need to go and kind of that brain to bladder connection. And so this kind of leads me into my next question of when I was struggling with the urine leakage, I would always think I should go to the bathroom right before I run in hopes that my bladder was empty. And generally speaking, I'm kind of like a camel. I used to joke when I worked outside the home. I hate public restrooms, by the way. So when I
Yeah.
worked in an office, sometimes I would pick up my girls at daycare and I'd say, "We got to get right home. I haven't gone to the bathroom all day," and they would crack up to the point where they'd start to ask me, like, "Did you make it the whole workday without going to the bathroom?" And so I generally had trained myself to go all day. I'm sure I was not drinking enough water. So I know that you're probably thinking there's no way you drank enough water, which I wasn't. But um, when I would run, it didn't matter when I had last gone. I would think I better go empty my bladder in hopes that it would help me leak. I don't think it really did. And then someone recently told me, you actually might have made the whole thing worse by doing that. So I'm curious your thoughts on that sort of practice of I'm about to work out, I'm about to run, empty the bladder or only go if you actually have to go.
Yeah. I'm always a only go if you have to go. Because the more frequent you go to the bathroom, the more strain you actually put on those muscles of the pelvic floor. You're teaching your body, oh, I can't hold it. I can't hold this little amount of urine in. So I'm going to keep going. And you strain those muscles, and those muscles become weaker because those muscle fibers just become more stretched and stretched. And so they're not able to support those internal structures as well. So I always encourage patients, if you feel you have to go, go. If you don't feel you have to go, then don't go. And over time, you're going to strengthen your pelvic floor just by doing that. So, the other thing I'll say too, in terms of like hydration, I'll have some people that say, I drink a ton of water all day, so I'm always going to the bathroom. I'm always going to the bathroom. So I ask the question, do you sip on your water throughout the day, or do you chug the water, in one sitting? And many people say they chug. So I'll encourage them to, gradually sip throughout the day, because you
Mm.
want your body to absorb the water. You want your cells and the tissues to absorb the water. If you just drink it really fast and you chug it, it's going to go straight down to your bladder. And then, yeah, you're going to have to go more frequently than you have to go. So it's not even a good practice, because your body is not absorbing the water as it should if you're a chugger and you're drinking it fast in one sitting. So gradually sip throughout the day, and then only go when you have to go.
I love that tip because I feel like that's just a general good little health tip. So we're better off if we want the benefits that we're all trying to get by drinking enough water to drink that slowly throughout the day rather than say, I'm going to chug 16 ounces
Yeah.
now, 16 ounces at lunch, 16 ounces at dinner.
Yeah, absolutely. Absolutely.
Awesome. So, a mom in my membership shared that a pelvic floor PT helped her tremendously after her cesarean, which I thought was interesting. And I don't know that everyone realizes, or maybe again, this is me just kind of being basic and naive, but that women who it's not just about vaginal delivery and kind of having pelvic floor struggles, that it could also be if you had a cesarean delivery and that group also may need to see a pelvic floor physical therapist. So can we talk a little bit about the cesarean delivery and how that has a different and unique effect on our pelvic floor?
Absolutely. So for one, when the woman a woman is pregnant, they're still going to create some type of stress and trauma. Maybe I shouldn't use the word trauma, but stress to the pelvic floor, just because you have a growing baby inside your body that will put this strain on the pelvic floor muscles. So naturally, you're going to have some weakness there. Additionally, when someone does undergo a cesarean section, they go through a lot of tissue that they're cutting, which changes the integrity of those structures. And so, what tends to happen, especially as you heal from having the incision from the cesarean, you'll develop scar tissue. And so, the scar tissue, it can cause issues, whether it's, you may not feel as much in terms of you feel numb, or you feel like you can't really recruit your pelvic floor, or maybe the scar tissue is causing a lot of pain in your pelvis, in your pelvic area, where you feel a lot of discomfort there. For some women, it causes issues of urinary leakage because of that built up scar tissue compressing around the bladder. You may have this urgency or this urinary incontinence or this frequency to go to the bathroom because you're constantly having this extra tension surrounding the pelvic floor, surrounding the bladder and the pelvic floor. So, what we do with cesarean section, or what we do with C section recovery, is we work to minimize that scar tissue as best we can, so that pain is minimized. We're reducing tension to help regenerate some neural signaling to, oh, I can feel these nerves again, and I now can feel how to recruit my pelvic floor. And so we do that in pelvic floor physical therapy with women that have C sections, because it is a lot that they go through. You go through many layers of cutting to get to the baby, And so it's that important to see a pelvic floor therapist to recover from that. So I highly recommend, I see a lot of patients actually for C-section recovery, and that's what we work on is minimizing scar tissue and teaching them how to even re-engage the core because that affects your abdominal core muscles as well. So there's a lot that can be done, and I've had some people who've said, well, maybe if I have a C-section, it'll avoid all these issues with, the pelvic floor. And that's not so true because there's a lot of things that do happen. So,
And how soon after the C-section, which is obviously a significant surgery, could someone start to engage with a pelvic floor physical therapist?
absolutely. So, typically, I recommend clients to come after they've had their 6-week follow up with their provider. So long as they've had that checkup and their doctor or midwife has cleared them, then they're safe to come to see a pelvic floor physical therapist.
Awesome.
Yeah.
Well, Dr. Bailey, this has been so helpful, so informative. Is there anything else related to pelvic floor health that you would like to touch on, or something you just wish everyone knew, or any final thoughts you want to share on the topic?
Yes. Well, I'll just say that in this growing niche of physical therapy, I think it's very important that for everyone to be more proactive in their care versus reactive. It makes such a difference in your lifestyle and your quality of life when you're able to go on the front end versus the back end. And not that, nothing can be done in the back end, it can, but it prevents so many issues from happening if you just get assessed. See what your pelvic floor is like, see what it's doing, have someone tell you, hey, you're engaging too much, you have an overactive pelvic floor, or we need to work on your core a little bit to help to support you, or here's a tip to use when you're using the bathroom. I think it's going to be extremely beneficial if we all can embrace that thought and idea that, if I go now, I can make a difference in my life in the long run. So that's my encouragement for anyone listening, just to get assessed and see how it can really change your life.
Absolutely. Well, thank you so much for joining me today. Can you please tell everyone how they can find you?
Yes. So you can find me on Instagram at 360 underscore health coach, or you can visit my website at www.360hws.com.
Fantastic. And we will link to all of those things in the show notes. Thanks again.
Thanks for having me.
Thank you for listening to How Long Till Bedtime. To learn how we can work together to improve your child's sleep, please visit sleepandwellnesscoach.com.